Imagine that you're being summed up to just your profession. I lost my first patient at 19, and I understand. If there's anything I understand, is that life is very fickle. Like, life is just like. He was 19 at the time, and I remember my colleagues and I telling him to hold on to life so we could see him during the next shift. Unfortunately, by the time we came back, he had passed on. I want to answer some questions relating to nursing. Where do I start? The first question is, what has been my best experience as a nurse? My best experience as a nurse, honestly, I think that my best experience, okay, let me give a story. There was this time that I think I was either in third year or second year. We had a patient, a psychiatric patient, when I was in my second year. So by the time I came back for clinical rotations in fourth year, because we were usually posted to a hospital, like we work in different segments of healthcare. You work in psychiatry today, the next day you are working in maybe something related to surgery, next day you are working in something related to eye care, so at least you have a taste of what the specialties in nursing is. So during my second year, I worked in a clinic. Was it a clinic? No, it was a hospital where we had a psychiatric patient in my second year. Then coming back fourth year, I saw this man, and this man was good looking. Like I was so happy. It was one very fulfilling time of my career. Then I work a lot in pediatrics. I don't know why. I like children a lot, and sometimes we carry out this procedure, the KMC, if the child is not in the incubator. Sorry that I'm talking too much, but when you do that and you just have to like hold the baby, I mean, it's so cute. Okay, so yes, I think that's a very fulfilling part of my profession. So the next question, what has been my worst experience in nursing? So we had this woman who came to the clinic for wound dressing, for a wound dressing procedure. On that particular day, we were short of gloves. We didn't have even normal gloves. We didn't even have surgical gloves. We didn't have any type of nylon gloves. We didn't have anyone. And this woman came to the clinic. In my good heart, I decided to scout around. I went around the hospital. I went to med lab departments, physiotherapy department, looking for hand gloves. So at least my colleague had already volunteered that she would do the dressing. Let me just at least get what we would use to do the dressing. So when I brought the hand gloves, like a pair of gloves, I arranged it. This woman, hey God, she started cursing me. She cursed me, she cursed my mother, she cursed my father, she cursed my family members, and she cursed my lecturers in school. I was trying to explain to her, ma, the delay is not from our end. This is a hospital problem. I was like, did I do a wrong thing going out of my comfort zone, going to source out gloves? Like that's been my very worst experience being a nurse. Yes. The next question is the hardest moments I had studying nursing and how I survived it. The hardest moment for me was my final year. My final year was quite difficult because we had a range of projects we had to submit with deadlines. Let me remember the courses. I think G and C, that's guidance and counseling. Then another one, I think I had like 3 critical projects to submit. Was it 3? Okay, two critical projects and my personal projects. And these 2, I was working on my group projects. and I was working on my personal project on these two. Then I had the main project, that's the university BNSC project I was working on. I had to also do my PowerPoint, prepare my PowerPoint, and we had to, all of us in our class, like it's a requirement for you to prepare PowerPoint for each of these. I was choked. Okay, so the next question is, how has nursing shaped my confidence and my identity? If I have an emergency, if I have an elderly person, if I have a young person to take care of, I know the right procedures to get the person back to health, like doing my best, I can get the person back to health. So if it's the confidence in that aspect, yeah. But if it's confidence in like you come to work and it gives you a boost, oh, I'm a nurse, yeah, sometimes, but not always. What advice would I give to a 21st century nurse? What advice would I give to a 21st century nurse? This advice is an advice that I take personally. So I would advise anyone that is doing nursing, any nurse, to do your best to be as good as you can in the nursing practice. Put in your best. It's a continuous learning process. If there are procedures, there are instruments you've not seen, if there are medications you're just seeing for the first time, be committed to continuous learning. Ask questions as much as you can. Yes, research, do your own homework, do your best, try as much as you can to be as skilled, like know what you're doing. If you're asked to administer a medication, know how, know why it's been administered. Then 21st century, there are a lot of innovations, there are a lot of things that are coming to place. Thank God for the advent of AMR, EHRs, then and a lot of AI computations going on in the healthcare space, telehealth, everything. So if you're a nurse and you have interest in these things, if you know how to code, if you like to code, please venture into it. If there are things that you like operations, like just know what you're doing, right? Don't just fix yourself and say, I'm just a nurse and that's it, I just want to shop in the clinic. If that's what you want, then good and fine. There are a lot of aspects of nursing that is very interesting, that is lucrative also. There's geriatrics, there's pediatrics, you can be a dialysis nurse, you can be a there's one, you can go into aesthetics, you can go into, I mean, it's a whole lot of branches there. We have, there are countless, yeah, there are countless aspects of nursing you can go into. In my personal journey, right from school time, I like working on projects. Just give me projects, give me operations, give me the running around, give me the let's get this work finished, let's get the process, let's do the planning, what is going into this, who is working on this, who are we talking to, who are we, like stakeholder management and all that. What are we implementing, any tool in achieving this aim in this healthcare sector, this and that. Yes, so that's something that I have delved into alongside pediatrics. I like pediatrics a lot. I like pediatrics and I like that aspect. I like operations management. So yes, I would advise anyone, just know yourself, be very self-aware. What are things that you like, and it does not necessarily have to be conventional, right? Yeah, so yeah, clock it. So yes, that's the advice I would give any 21st century nurse, any person coming out from nursing school, even those that are already in nursing practice. If there are skills you think you need to learn, if there are certifications you need to add up, if there are things you need to learn, if there are areas you need to get broadened on, please go for it. Yes, the respect you are giving, the value you are adding to the healthcare sector is not hinged on your professional name. It is hinged on the value you can offer. Yes, it's hinged on the value you can offer. So thank you so much for watching to this part. Today was a very calm day in the clinic and I had to shoot this video. So thank you for staying tuned. I will see you on my next video. Thank you. Ciao.